Good morning, it's Dr. Larson here to talk about COVID-19. It's a couple of days before Christmas, and I know everyone is anxious and ready to have a normal Christmas, and it's really not time quite yet. So everyone is tired, everyone wants COVID to be done, but COVID's not done with us. We'll talk a little bit about the Omicron variant at the end today, but first off, I'm going to talk about how to be safe during the holidays. So we are doing pretty well in Kittitas County currently with COVID-19. We did not end up being involved in this big outbreak with wrestling because our teams are testing and being safe and doing those things, but there's a lot of COVID out there. We are doing better currently than we have for a while. That said, those people that are at high risk are still really at high risk with COVID. So if you're planning on traveling this holiday season, make sure that you're wearing a high quality mask. Masking is one of those public health tools that there's been a lot of confusion about, but essentially masking works. The science is there. A high quality mask, a KN95, a surgical mask, if you're traveling by bus, by plane, if you're planning on spending time inside, make sure that you're wearing good respiratory protection. So a KN95, a surgical mask or above. You should be vaccinated and you should be boosted. They still work. Omicron and waning immunity has had an effect on those things, but they still work. They still keep people out of the hospital. They still keep people from dying. We've had 60 people from Kittitas County die of COVID. And the reason that that's not higher than it was is that lots and lots of you are working hard at preventing disease in others. So make sure that if you have a chance to get your booster, please step out. There's lots of places in the community to get it. All the pharmacies, your healthcare providers, all are providing boosters. And there have been a few large events, vaccination events that have happened in the county. So please get vaccinated, please get boosted. The other things you can do is typical public health things. Wash your hands. Stay home when you're sick. So even if you think you don't have COVID, if you're sick, you shouldn't go visit your grandmother over Christmas. There's always next year at Christmas. You don't really want to bring something to your relatives that are at risk. So protect those that are at high risk, the elderly, and those people that are under 5 who can't be vaccinated. So wash your hands, wear masks, don't go to work, don't travel when you're sick, and get a booster and be vaccinated if you've not. Our hospital's still doing okay. Our healthcare providers are tired. Our teachers are tired. It's good that they have a break. Hopefully we won't see a big increase from Omicron, but that's my expectation, is that we will see a big increase from Omicron. So and that'll occur over the holidays. And so as we go back into the school year this next year, we will have a lot of disease. That particular variant is much more infectious, and it is reinfecting people who have had COVID in the past, and it is infecting people who have been vaccinated with 2 doses of Pfizer or Moderna. So those vaccines are still helpful to reduce hospitalizations and deaths, but a booster really is helpful for that. And so that's the reason for a booster. And my expectation soon, the definition of fully vaccinated will be 3 doses of mRNA vaccine or 2 doses of Johnson & Johnson. So you might as well step up and get that done because it's coming. We don't know how severe the disease will be with Omicron. It looks hopeful, but based upon the fact that each person with the disease is infecting 3 to 3.5 others, there'll be lots and lots of disease, which has a real likelihood of overwhelming our hospital systems. And if our nurses in the intensive care unit have their kids get sick with Omicron, they're not going to be able to work because they have to be at home taking care of their kids. So then they're not available for us when we need them, if we're having another medical emergency, we've fallen and broken our hip or those type of things. So remember to be kind, remember to look out for others. Those 60 people who passed away in Kittitas County of COVID all have family, plus we've had a lot of other people die in Kittitas County over the last couple of years. There will be an empty spot at tables this Christmas holiday, and remember those people, remember the people that have lost their loved ones. Make sure you thank a healthcare provider, you thank a teacher, you thank a grocery store worker. All those people are working really hard, and take good care of yourself, and we'll see you next year. Thanks a lot.